Hi, I am Dr. Shweta Nayak, Consultant Obstetrician Gynaecologist and Laparoscopic Surgeon, Motherhood Hospitals, Yadavgiri, Mysore. Today we are going to discuss about uterine fibroids. About 30 to 35% of the women belonging to age group of 30 to 40 years have these uterine fibroids. Fibroids are nothing but they are non-cancerous growths arising from the smooth muscle cells of the uterus, and they can cause various symptoms ranging from abnormal uterine bleeding to pain abdomen. Most commonly, these fibroids are asymptomatic most of the time when they are of the smaller size. But as the size increases, they cause various symptoms like heavy, painful periods. And sometimes the periods can be painless, but they can be prolonged. And sometimes they cause pelvic pain, just pain alone. And rarely they cause some bladder symptoms like increased frequency of micturition and difficulty to pass urine. In such case scenarios, you have to consult the gynecologist, and usually these are diagnosed by doing ultrasonogram. A simple ultrasonogram can show the size, extent, location of the fibroids. These fibroids can be located anywhere inside the uterus. They can be outside the uterus, partially inside the uterus, or deep within the cavity of the endometrium. And we call them as subserous, intramyometrial, and submucous fibroids. Depending on their locations, the symptoms can vary. And once diagnosed, they definitely need some treatment. If they are very small and bleeding is minimal, they can be controlled with just drugs alone. Drugs like tranexamic acid, mefenamic acid help them to treat. But if the bleeding is heavy and pain is intolerable, they definitely require surgery. This surgery is known as, the surgery for uterine fibroid is known as myomectomy. And surgery for uterine fibroid definitely depends on the age of the patient and fertility of the patient. If the lady is young and not yet completed her family, then usually myomectomy is advised. And if the lady has completed her family and belongs to perimenopausal age group, that is usually more than 40 years of age, then along with the uterine fibroids, hysterectomy is also performed. These surgeries can be performed in two routes, either by open surgery or endoscopic surgery. Again, these endoscopic surgeries can be varies, like fibroid is located outside the uterus, then usually laparoscopic myomectomy can be done, and if it is deep within the uterus, hysteroscopic myomectomy has to be done. And being, as I told you, they are simple non-cancerous lesions. There is no fear of cancer in these tumors. Only very rarely, that is 1 in 1 lakh cases, can become cancerous. That is known as leiomyosarcoma, which is very rare. When there is sudden increase in the size of fibroid or severe pain associated with the fibroid, then the cancer has to be suspected and treated. So, for all these fibroids, once it is detected, appropriate treatment has to be taken and appropriate surgery should be done.